Following intravesical treatment for non-muscle invasive bladder cancer, patients will often experience side effects. It's important that these side effects are monitored accurately, as it allows nurse specialists to ensure the patient's treatment is optimised. Medac Pharma have developed an app that allows patients to report post-treatment side effects from home in real time. This leads to more accurate information being provided to their nurse specialist, meaning symptoms can be managed effectively and the overall patient experience is improved.
Home visits are an important part of the job for specialist urology nurse Anne-Marie Wilkinson.
A large part of my role is administering intravesical treatments. Hey Duncan.
Hello Anne-Marie.
Hiya. How are you?
All the better for seeing you.
Duncan's been receiving weekly treatment after having a tumour removed from his bladder, and like many people undergoing cancer therapy, has experienced side effects.
Known as peeing razor blades.
Right.
Frequency going to the toilet, passing blood and what have you.
And it's really important that patients report them as soon as possible.
It makes a huge difference in terms of decision making for nurses, because you're actually making a decision on patients having more treatment, whether it's safe or it's not safe to do so. Historically, symptoms were assessed 1 week post-treatment. And I was finding that patients were having difficulty recalling their side effects accurately 1 week post-event. So I felt if we had a way of developing a means where patients could take control of their own monitoring, and as healthcare now embraces technology, I felt an app was the right way forward.
The BC Care Tracker app was developed by Medac Pharma based on Anne-Marie's idea. It takes just a couple of minutes for patients to log any side effects 24 hours after treatment.
With the treatments it would give, the side effects often occur 3.5 to 4 hours post-treatment administration, and then perhaps go on for up to a 24-hour period. So patients get a notification to their phone 24 hours post-treatment to tell them to fill in a symptom assessment log. And that's when you get the scoring in real time.
The answers to 8 simple questions are sent back to the patient's healthcare practitioner. In Duncan's case, that's Anne-Marie, so she can review his ongoing treatment and decide if she needs to make changes.
It's very user-friendly. It's normally what you'd be asked by the nurse the following week. The thing is, you're answering while it's fresh, and it's just follow it through. I was very surprised when talking to Anne-Marie the week after one treatment. My recollection wasn't as clear as I thought it had been. What I'd reported on the app wasn't quite how I remembered it. The app asks you specific questions and it makes you think about it more before you. In general, you tend to think, oh, that wasn't too bad or wasn't too good this time. But the app makes it more specific.
The app came from Anne-Marie herself, came from the practitioner. And I think that this is something that's really important for the pharmaceutical industry to do, is to listen to their customers. I think that there's often been a perception with pharmaceutical companies that they're only there to provide medicines, but actually I think there's a responsibility for us to do a lot more, to provide support and help for healthcare professionals and their patients. We wanted to keep the app as simple as possible because obviously this is used by nurses and their patients in their own home. So we want to make it as straightforward as possible for the patient.
And because it's all based around an app, wherever the patient is, it's quick and easy to log and submit any side effects safely and securely.
Patients have embraced it and been only too keen to get involved because it empowers them. They're actually taking some control and they're hugely reassured by the fact that that data comes to me the following day.
What the app does is put down exactly what I was experiencing while it's fresh in my mind, and it asks the right questions to draw the answers from you that the nurse needs to know.
Helping patients help practitioners to keep track of their treatment journey.